10 silent warning signs of prostate cancer in men over 50. Have you ever woken up in the middle of the night feeling the need to pee? But did you know that frequent urination at night is not just a normal part of aging? Did you know that this could be a sign of a bigger problem, a disease that many men your age are facing? I'm Dr. Recheal from Vital Eternity, your partner in unlocking a healthier, more vibrant life through knowledge and proactive care. As a men's health specialist with years of experience guiding patients through preventive wellness, I've witnessed how subtle symptoms can signal serious conditions like prostate cancer, one of the top cancers affecting men globally, with over 1.4 million cases diagnosed annually. The incredible news? When caught early, prostate cancer has a near 99% survival rate, according to the American Cancer Society. Today, I'm here to empower you with life-changing insights about 10 often ignored warning signs that could be your body's way of sounding the alarm. These aren't just symptoms, they're opportunities to take control of your health before it's too late. Whether you're watching for yourself or a loved one, this information could be the key to a longer, healthier life. Let's dive in, explore these signs with clarity, and make this knowledge go viral to save lives. If any of these resonate, don't wait. Schedule that doctor's visit today. Your health is worth it, and at Vital Eternity, we're all about living fully at every stage. Picture yourself wincing during a trip to the bathroom, feeling a sharp burn or pain as you urinate. It's easy to dismiss it as a minor irritation, maybe dehydration, a spicy meal, or just aging, right? But this burning sensation could be an early distress signal from your prostate. When cancerous cells cause the prostate to enlarge, it presses on the urethra, disrupting urine flow and triggering discomfort. This isn't just a nuisance. It can lead to infections or kidney issues if ignored. I've seen patients shrug this off for weeks, only to learn through a simple PSA blood test that early action could have prevented complex treatments. If this pain persists beyond a few days or feels unusually intense, it's time to see a urologist. Tests like a digital rectal exam or imaging can catch issues early, offering you the best chance at a full recovery. Prostate cancer often hides behind symptoms we normalize, but listening to your body is your first defense. Let's make this go viral. Share this with every man over 50 you know. Those restless nights spent racing to the bathroom can feel like a cruel thief of sleep. Waking up 3, 4, or more times to urinate, medically called nocturia, leaves you drained, cranky, and blaming that extra glass of water or evening tea. But frequent nighttime urination is a classic red flag for prostate cancer that too many men overlook. An enlarged prostate, whether from benign growth or malignancy, irritates the bladder, signaling urgency even when it's nearly empty. Research shows 1 to 2 nighttime trips might be normal past 60, but 3 or more, night after night, is a call to action. At Vital Eternity, we advocate tracking patterns. Note your fluid intake and sleep disruptions. If this persists, a PSA test or ultrasound can reveal if the prostate is the culprit. Ignoring this risks more than exhaustion. It allows cancer to advance silently. Don't let it steal your vitality. Get checked and share this with a friend who's tossing and turning. Early detection turns a potential crisis into a manageable fix. Spotting blood in your urine, whether a faint pink hue or a stark red, can stop you in your tracks. It's tempting to brush it off as a one-time infection, a kidney stone, or even post-workout strain, but hematuria is a serious warning sign of prostate cancer. Tumors can invade blood vessels in the prostate, bladder, or urethra, causing visible, gross, or invisible, microscopic bleeding, detectable only through tests. I've counseled men who delayed, assuming it was minor, only to face advanced cancer later. Don't take chances. A urinalysis, cystoscopy, or MRI can pinpoint the cause. With 1 in 8 men facing a prostate cancer diagnosis in their lifetime, especially those with family history or African American heritage, urgency is key. This isn't just about you. Share this knowledge to spark conversations. Comment below if you've seen this symptom. Your story could inspire someone to act. Early action is a lifesaver, and we're building a movement for proactive health at Vital Eternity. That persistent ache in your lower back, hips, or legs might seem like the price of a desk job, heavy lifting, or just getting older. But unexplained, ongoing pain in these areas could signal prostate cancer spreading to your bones. As tumors grow, they target the spine and pelvis, causing a deep, nagging discomfort that worsens at night or resists rest and painkillers. Unlike a strained muscle, this pain lingers without a clear cause. If stretches, massages, or meds aren't helping, it's your body's plea for attention. Bone scans or CT imaging can confirm if cancer is involved, and early treatments like hormone therapy can halt progression. Risk factors like smoking or obesity amplify the stakes, but regular screenings flip the odds in your favor. At Vital Eternity, we champion holistic health. Add anti-inflammatory foods like salmon or walnuts to your diet, but don't skip the doctor. This sign is a wake-up call. Let's spread it far and wide to protect our brothers, fathers, and friends. Unexplained weight loss might feel like a happy accident. Losing pounds without dieting or exercise sounds great, doesn't it? But dropping more than 5 to 10% of your body weight in 6 months without trying is a serious red flag. Prostate cancer cells can disrupt your metabolism, sapping energy and causing muscle and fat loss, often paired with fatigue or reduced appetite. This isn't about fitting into old jeans, it's your body signaling distress. Blood tests, PSA levels, or scans can uncover if cancer's at play. I've seen patients celebrate this initially, only to regret delaying diagnosis when treatments became tougher. Lifestyle matters. Poor diet or stress can worsen risks, but annual checkups are your safety net. If this sounds familiar, don't wait. See a specialist. Let's make this viral. Share your story in the comments to encourage others. At Vital Eternity, we're about thriving, not just surviving. Act now for your future. Ever felt a strange pressure or discomfort in your rectal area, like something's pressing down or you're battling chronic constipation? You might blame diet or stress, reaching for fiber or antacids, but persistent pain or bloating could mean prostate cancer is spreading to nearby tissues. The prostate's proximity to the rectum means tumors can cause irritation, mimicking digestive issues. If these symptoms last beyond 2 weeks, especially with urinary changes, a rectal exam or ultrasound is critical to rule out malignancy. Early-stage cancers respond well to targeted therapies, preserving your quality of life. Men often stay silent, but breaking the stigma starts with awareness. At Vital Eternity, we're building a community of proactive health. Share this with someone who needs to hear it. Early action prevents complications and keeps you in the driver's seat. Discomfort when sitting for long periods, like on a long flight or at your desk, might seem like a chair problem, but persistent pelvic pain, numbness, or pressure could point to an enlarged prostate pressing on nerves. This isn't just poor posture. As cancer grows, it impacts surrounding structures, worsening over time. If cushions or adjustments don't help, a prostate exam is essential. This subtle sign is easy to miss but critical to catch early. Struggling to start urinating or noticing a weak intermittent stream? This urinary retention, hesitation, dribbling, or incomplete emptying signals a prostate blocking the urethra. It's frustrating and a key indicator of potential cancer. Don't normalize it. A urologist can assess with tests to catch issues early, preventing disruptions to your daily life. Incontinence, leaking urine during a laugh, sneeze, or sudden urge, isn't just aging. Cancer or treatments can weaken bladder control, impacting confidence. Pelvic exercises or medical interventions can help, but early screening identifies the root cause, restoring normalcy. Painful ejaculation, a sharp sting or dull ache during intimacy, can stem from prostate inflammation affecting seminal ducts. It's personal, often unspoken, but if it's frequent, it's a signal to check for cancer. Don't ignore it. A doctor's visit can clarify and protect your health. These 10 warning signs, from burning urination to painful ejaculation, are your body's way of urging action. Prostate cancer begins with rogue cells forming tumors that can spread to bones, bladder, or rectum if undetected. Risk factors like age, genetics, or lifestyle increase vulnerability, but annual screenings after 50, PSA tests, rectal exams, catch it early, boosting cure rates. At Vital Eternity, we're passionate about your lifelong wellness. Adopt a prostate-friendly lifestyle. Think exercise, greens, and stress management. But don't skip professional care. Subscribe for more life-saving tips, share this video to raise awareness, and comment your experiences below. Your story could inspire someone to act. Thank you for joining me, Dr. Recheal. Let's live vibrantly together. See you in the next video.